This learning object is a production of Abu Dhabi Men's College, Center of Excellence for ICT and Learning Technology.
Today I'm going to show you how to give a bathing for a baby. Bathing is a procedure, usually you do it when you are caring for a baby in maternity or in pediatric ward. So what we need for bathing a baby? The equipment is needed as the following. We need a towel, baby's dress, Pampers, shampoo or soap with pH 5.5. We don't want any soap or powder which has soap pH who has more than 5.5 because it might cause allergy and infection for the baby. That's why I'm going to remove this out. We need gloves in case the baby has soiled a diaper. So we need also a container with warm water and cotton to clean the baby's genital area in case it's soiled. We need alcohol swab, thermometer to check his temperature, and we need cotton balls which are either sterile or clean. And big bag to throw all the soiled equipment there, and a tub container that I fill it with half level of water, not more than half, because I need to prevent the baby from the level of the container, because if accidentally the baby will slip down, we don't want the baby to swallow the water and aspirate, or his head will go down and will be submerged by the water. So make sure the level of the water not more than half of the container. So after I have prepared my equipment, I'll go and check on the baby and prepare him for doing the procedure. So make the side rails down. Always check the diaper. Don't start bathing the baby if the baby has a soiled diaper. Check diaper. If the diaper is soiled, clean it, remove it, wash your hands, then you start bathing the baby. So in this baby, I have checked he has a clean diaper, so I'll keep it on. I have undressed the baby and I have wrapped him very well to prevent him from losing temperature. So before you do the procedure, make sure you are not leaving the baby unattended. Always raise the side rails because you are afraid the baby might fall down. So whenever you are doing the procedure, keep on your mind, we have to keep three main principles, which are keep the baby warm, maintain security and safety, and keep the temperature of the water within normal level. What I mean by normal level, temperature should be within 36.6 and 37.7. How can I know if the temperature is within normal level? I'll check it with my wrist or elbow, as I'm doing now. Okay, it's normal. So before I start, I need to prepare my equipment near to the baby. So I'm going to remove the towel. Prepare it beside the baby. Face and the head. Put the side rails down. Most important when you are caring for the baby or giving him hygiene, make sure to support him properly. Using non-dominant hand, support the baby's head, neck, and back. And the whole body, it should be supported between your shoulder and your body. So carry the baby and put him under your shoulder. Press your shoulder in his body to make sure that he will not move. Don't carry the baby if you are not sure that you are holding him properly. So again, I will repeat. With your non-dominant hand, support the baby's head and back. The baby's body should be supported well under your shoulder and body. So you carry the baby, put him under your shoulder, and press in a way the baby cannot move. Make sure to close his ears by your fingers because we don't want water to go inside his ear, then he will have infection or she will have infection. So after you have hold the baby properly, You go. Now I'll start cleaning the face, dry the face and the head, then I'll go to the whole body. So what I need 3 cottons, 1 for the eye, for each eye, each cotton for each eye, 1 for the face, and 1 for the hair. Usually we don't clean the eyes, but we clean the eyes only when it is soiled. So when I want to clean it, I'll take 1 cotton, squeeze it very well, remove the water, then I'll clean from the inner of the eye to outside. One time, I throw it outside. Second one, using second eye from in to out, and I throw it. As you have seen, I used clean water with cotton which is dry, sterile, or a clean one. Then I'll do the third one, which is cleaning the baby's face. I squeeze the water very well and I clean it in a very easy, soft way. Cleaning the nose, under the lips, and finally the neck. Then I'll throw it. After I finished from the face, I'll start with the head. So what I want, I need a little shampoo, which I said 5.5 pH, any type of shampoo that doesn't have high pH. High pH may cause alkaline and cause infection to the baby, which we need to avoid it. I then put some water in the baby's hair. Then you make a nice, gentle rubbing for the hair. Make sure not to leave any area. Then you wash it by water. Again, make sure you are closing the ears to prevent any water to go in. Okay. After I have finished, clean the head and the face. I'm going to dry it now. Put the baby in a gentle way. Dry it softly by making a soft rubbing to the head and a patting motion to the face to dry it very well. As we know, the baby's head has a big surface area in the baby's body. In this way, the baby might lose heat through evaporation. So the best way to prevent losing heat is by drying it very well. So after we finish drying the baby's head, I'm going to move now to his body. Again, we are going to focus at the principle of security. Security, it means I need to handle baby properly to prevent any injury, accidental injury. Before we hold the baby, we check again the pampers. If the baby's pampers is soiled, I need to put on gloves because any body fluid, we don't know, may the baby have any infection, can be transmitted to you. So in case the baby's pamper is clean, I just remove it, holding the ankles, raising the hip, and remove it outside. Then I should carry the baby in a proper way. Again, by your non-dominant hand, hold the baby using your hand, supporting the head and the wrist. By the hand, you hold very well the baby's hand. Second dominant hand, you use and hold very well the baby's ankle. In this way, you have supported the baby very well. Make sure don't move the baby unless you are holding him properly. So again, you support the baby's neck and back by your wrist, and your hand hold his hand very well. Second non-dominant, you hold the baby's ankle properly, then you move